Oh, what's up? Happy Valentine's Day and weekend. I got Levert playing and some love music, Hopefully you had a great Valentine's Day and Valentine's weekend. Welcome to Barbershop Talk. Good morning, Barbershop Talk. Thank you for tuning in. 2/15/20. Happy Valentine's Day and Valentine's weekend. Hopefully you had a great time with your significant other, celebrating love, celebrating black love, celebrating the privilege of having someone in your life. So hopefully you are continuing to celebrate that this weekend. We want to apologize up front. A lot of us have colds and we're groggy and so on and so forth today. So as we go through our show, we do apologize for some of that grogginess. But we wanted to welcome you to our show. We got a great show with Dr. Brewer today. Amazing individual here in our community. So let's jump right in to what we're getting into, and let's talk about what's going on. We want to first, again, talk about our leadership calendar here at Barbershop and Social Services and Barbershop Talk. This goes towards a worthy cause, Seeds of Wisdom Academy, a Black-owned and operated school here in Rochester, and then also here at Barbershop and Social Services as we continue to grow and need to raise funds to get better at what we do. Most of all, here in Black History Month, and happy Black History Month to you again, this is about Black imagery. This is about positive minority images in a sometimes when we don't get to see a lot of those. So we're doing our part with that. Please buy one. We want all 500 people who like us and follow us to buy a calendar. PayPal. Pick it up there, and we have it on our Facebook site, or you can get it face-to-face. $25 on PayPal. We mail it to you. $20 face-to-face. Make sure you get one here to celebrate Black History Month and local minority leaders. Also, tomorrow, Sunday, at the Christ Church of Jesus Christ Hour, 11 a.m., Dr. Brewer, who was our guest today, will be having the red dress, red tie Sundays. This is all about heart disease for women, particularly minority women, but it's about heart disease, and she's going to be speaking towards that, obviously pushing for cardiovascular health within our women, and so that's going to be a great event, again, at the Christ Church of the Jesus Christ Hour at 11 a.m. tomorrow. It's going to be a great event, so make sure you're there if you're concerned about women's health. And then lastly, February 26th, we're going to have the good brother, Dr. Jason Soul, here at the Barbershop. If you know Dr. Jason Soul, the man is competent, the man is nationally renowned, he's getting things done, but most of all, he keeps it real. He keeps it real, and we love him for what he's doing. He's running the organization called Humanize My Hoodie. It's making some national attention at this point. So we're going to have Dr. Jason Soul with us on Wednesday, February 26th, so make sure you tune in. Please look at these other things that are going on in our area.
Greenhouse Graphics, we offer award-winning design services at affordable rates to help your business attract customers and ultimately affect your bottom line. Working with you one-on-one at whatever stage you're at in developing your brand. I want to help drive success to your business with excellent design and quality marketing materials. From startup companies in need of custom graphics, websites, logos, to seasonal maintenance, I got you covered. I take time and listen and care about your needs. I understand that image and quality mean everything in business when it comes to leaving a lasting impression on your clients and customers that lasts a lifetime. With nearly 2 decades of experience, it is in my DNA to create eye-popping graphics for your business. Greenhouse Graphics, making sure you always look your best.
All right, for our Keep It 100 segment, these are the topics we're going to jump into. Okay, we're going to talk about Gail and Snoop. What a big issue that has been in the last week and a half. It blew up in our communities of color, in our black community for sure. We'll jump in on that topic. And then local policing. A big issue happened this past week, or it was uncovered this past week via KAAL, and a great news story on something that happened very badly in our community. We love our law enforcement communities. We love what they do, but this was certainly something that all of our community needs to be aware of to hold all of our public officials accountable and make sure they're doing their best for us. And we're supporting them, of course. So we'll talk about that. Then Hair Love. Hair Love won the Oscar Award this past week. And we're going to talk about black hair, being more comfortable with black hair. Colorado was the latest state to pass a law that you cannot discriminate against black hair or minority hair. So we want to talk about that. Apparently Minnesota is grappling with that also. Then we're going to go into the Donnie You Crazy segment and talk about the best black love movies. Of course, Love and Basketball always gets the tops, or Love Jones, one of the two. But hey, we're going to go way back, way back, and talk about Billy D. Williams. Yes, girls, scream if you have to, and Diana Ross in the movie Mahogany. So which is the best black love flick out there? So we'll jump into those topics when we get to the show. Barbershop Talk South Minnesota, urgent news for you. We have reached 500 likes on Barbershop Talk South Minnesota Facebook. We also have 500 plus followers on this same site, and that tells us that you all are liking what we're doing, and we just wanted to say thank you for the 500 plus likes, the 500 plus followers, plus all of you that say great things to us in the community. You like what we're doing. We appreciate you, and we thank you for appreciating us. 500. Hey, to celebrate real quick, please get the Barbershop Talk Leadership Calendar. We created this as a fundraiser. All the proceeds, or part of the proceeds, go to Caesar Wisdom Academy and Barbershop and Social Services. This is a fundraiser. Help us celebrate Black History Month. Help us celebrate diversity in our area. And help us celebrate the 500 likes we got here this week. Thank you for tuning in. Thank you for all of your support. Get your calendar. Thank you for your continued support. 500. Thank you for tuning in. Now we have Dr. LaPrincess Brewer. Please welcome her to Barbershop Talk. All right, Barbershop Talk, what's happening? Welcome again on a Saturday. If I sound a little groggy, it is true. I think we're all nursing some colds and some flus and some whatever's here today. So excuse us as we get through the show, but we wanted to welcome you to Barbershop Talk South Minnesota here on the 15th of February, just after, what's that holiday we had yesterday? Valentine's Day. Yeah. So thank you for tuning in. We love to go by the quote, we all do better when we all do better, and that's what we all are about here. Real quickly, we want to promote our calendar, our leadership calendar. It is out. It is ready to go. We have Dr. LaPrincess Brewer on here as well. So these are ready to go. Get on PayPal, buy them for $25, or if you come over to the shop and buy them face-to-face, $20. It's a fundraiser. Goes to Seeds of Wisdom Academy partly, and then what we do here at Barbershop and Social Services. So please help us sell these. It's for a great cause. And probably the biggest cause, but I would say of this, is to show Black imagery, minority imagery in a positive light. We often do not see, for whatever reason it is in our media, positive images of our Black, brown, and minority folks. And this is an opportunity to see 12 people in our community, professionals that are making a difference in our community. And so that's why we got this calendar together, is to celebrate our community, and this is our first annual one. So pick it up, $25. Thank you for tuning in. So, anything else going on, bud?
Nothing else. On the 26th, we got Jason Soul coming in.
So. Oh yeah, that's right. Jason Soul will be here. He will rock the house.
Yes.
He will bring it.
Yes.
So Jason Soul will be here. That's on a Wednesday. So we'll have here.
Shout out to Jason.
Yeah, we'll be looking forward to having Jason here on our next show. So, as we do, we have our Keep It Real segment at the top, and we've already warned Dr. Brewer she doesn't have to jump in. Al's here today, by the way, and so Al can jump in if he wants to. The first one we're going to get into is, and we got to go there, the issue with Snoop Dogg and Gayle King. I think it was it last week? I listened to Snoop Dogg. I'm gonna tell on myself.
Let's go.
And his comments against Gayle. And I hadn't listened to the Gayle interview yet. And I'm like, dang, Snoop. But I wasn't surprised. It's Snoop Dogg. I mean, this is the dude in the '90s, gin and juice, on and on and on. This is why we've made him such a beloved figure now, right? With Martha Stewart and all that. I'm like, it's Snoop Dogg. What do you expect?
Yeah.
And then I listened to the Gayle King interview, and I'm like, oops.
Yeah.
I think she did go a little too far. And to me, it's timing. The timing issue is she probably should have waited. What do you all think?
Well, with the comment with Snoop Dogg, it was raw. It was real.
It was raw.
If y'all didn't see, he put out another comment a couple of days ago, maybe yesterday or the day before, apologizing.
Right.
To his reaction, to how he called her out her name and his initial reaction. He reacted out of emotions, and that takes a man to do that.
Right.
So I tilt my hat to that. I don't call women out of their names myself.
Right.
You know, so, but it was raw and it was real. And like you said, it was Snoop.
Yeah.
As far as Gayle with the, with pushing that issue, I don't think it's right.
Right.
I know it's what the people want to hear, and I don't know. I wouldn't have done it.
Right. Yeah, it just seemed a little too quick, too soon. Beloved figure, and given the community that we often represent, if he did make a mistake, quote unquote, however you look at that, people can overcome and become better, and so on and so forth. So, but that was interesting, and again, I'm telling on myself because when I first heard it, I'm like, no, it was raw.
He wasn't the only one. He wasn't the only one. It was a few videos.
It was few. Yeah, Bill Bellamy. I listened to his as well.
Yeah, one of the rappers, Lil Boosie came in.
Oh, he dropped it too?
He went hard on it, yeah.
Okay.
Favorite reaction.
So, and thankfully they're celebrating Kobe Bryant this weekend at the All-Star game, and so on. But I definitely had to.
Did we get your take on it?
So I just don't like the conflict in our community.
Yeah.
Right.
So I'm just glad that it seems like we're reaching a resolution there.
Right.
But yeah, it's a difficult conversation, and I agree with you that it probably was the timing that really, I mean, everyone's still healing from that unfortunate tragedy and loss. So I just hope I don't get any Gayle King questions today.
Oh, you might be the leader that you are, Dr.
Oh.
You might.
Well, we ain't gonna get no Gayle King.
Our next,
I love Gayle, but
yeah, she's good. She's good. Our next topic is hair love. Got an Academy Award for celebrating black hair. Colorado was the next state that has passed a law where you cannot discriminate against hair. They're the latest state. I think 5 others have done it or something like that. So that's pretty cool. Both getting the Oscar award and this happening in Colorado. I don't think Minnesota's come up on that yet.
No, I don't think so.
Are we reaching the time where not only black hair, but just being black and the beauty of being black can be celebrated? Or locally, are we dealing with this issue continually, particularly for our women, black women? Are we getting beyond this issue, or is it still an issue? Let me give you an example. I forget her name. She was and I'm not telling on her or a local station, but she was a reporter for a local station here. And I remember, it was about 5 years ago, she said she couldn't wear natural hair to do reporting. I'm like, what? So are we getting past that issue here, or is it something maybe Minnesota needs to pass as a law?
So I'm gonna say I actually watched the Hair Love the movie, the short animated film this morning, and I absolutely loved it, and I was actually in tears this morning drinking my coffee, and it resonated, you know, so much with me. Just thinking about my own natural hair journey, and you know how initially I was not comfortable wearing my hair in its natural state as I am today. Even, you know, not necessarily just to, I mean, even to work was really a reach, but even, you know, just normal walking around. But you know, it's been a journey for me, and just seeing the recognition of that and seeing myself in that movie was amazing.
Oh, that's awesome. That's awesome.
Yeah.
My daughter looked at it as well, and she was really proud of that. That was good.
I think it's I love the natural beauty that black women possess, and I think it's good to be good in your own skin and feel proud of who you are. Both my daughters at the time, were the last recent couple of weeks of wearing natural hairs. Shout out to Portia and my babies, you know, and I've been telling them how I've been giving them compliments, and how proud I was for them to have the confidence to do that.
Well, good.
And you are possessing it with it.
Oh,
Yeah. Rocking it.
It's who I am.
Yeah, that's right. Our next issue is kind of controversial, but I given we really we're proud of being the voice of the voiceless here on Barbershop Talk, we really have to say something about this, and I'm not sure where it should go. Maybe see this as an awareness, and it's shocking to me, not at what happened. It's not shocking how it was reacted to, although both of them will be shocking when I speak to this. But the community reaction, or the lack thereof, is what's shocking to me. ABC, KAL sent out a great TV reporting about, and let me preface this by saying, we've had Sheriff Torgelson here. We've had Chief Jim Franklin here. We love these guys. We think they're great leaders in our community. And this is not a knock against our area law enforcement. However, in the light of what a lot that goes on in our African American communities, this has to be highlighted.
As we talked about.
Yeah. And look at the article. I won't get it totally correct, and we can put it up. We actually put it up on our Facebook. But long story short, a young lady, low-level drug charges. The cops were coming after her. Non-violent type of scenario. They couldn't find her in a local Walmart or something like that. They went outside of the Walmart to find her. Couldn't find her. They decide to sick the dogs on her, or to try to find her. And you can even hear in the audio one of the officers is saying, "Hey, our dog will bite you. You need to come out." Lo and behold, a homeless man is there in the area where they're searching. The canine went after this homeless man, ate off a third of his scalp.
Pulled him out by his head.
Yep.
The canine pulled him out. He was sleeping in a tent.
Yep.
And pulled him out by his head and took out a third of his scalp.
Third of his scalp, and from what the report says, it's so bad they cannot even replace the lining on the skull. So I don't even know how that works medically. So obviously they got the wrong person, homeless man.
Mm-hmm.
Where it gets real nasty, well, that's nasty in and of itself. Why would you sick dogs out on a low-level offense, having been a former police officer? It just didn't seem like something like that is necessary. That's from my opinion.
He got a pretty hefty settlement.
Yeah. He got a settlement for $650,000 for this damage. And then the county, from what I understand, Mark Ostrom's office and the sheriff kept it really, really hush-hush. It's alarming to me, and again, we really support our law enforcement, that it was kept hush-hush, one, and then the settlement, which is good. $650,000 is pretty steep. However, considering what the medical costs might be, the legal costs, homeless man probably didn't get much out of that. So, again, it's scary that you would sick dogs out on a low-level offense. Something like this would happen, and then when we have a police oversight committee in our town, I don't know if they knew about this, and we didn't, as the public didn't know about it. KAAL, great job, KAAL caught on to it, and they exposed this issue in our community. Again, we got great cops here, so on and so forth, but things do happen sometimes where this question comes up, and we need to hold our folks accountable. From what I hear, this is hearsay, that canine that attacked that individual is still at work, still on the force doing the job. So that is very, very concerning when you think about homeless man. Think of advocating for the least of these.
Yeah.
We really got to think about that. Community, just be aware of that. Again, I don't know where it goes from here. The county did their thing, the county board, Mark Ostrom's office, the sheriff. Watch the video. But it is concerning in light of a lot of things.
The guy that was involved, he was in rehabilitation center for 2 years. And I saw him yesterday. He's actually doing good now.
Oh, really? Okay. Oh, okay. Good.
Yeah.
So that's
He's
good.
actually doing good now.
That's good. Well, we had to talk about that given what we do, and we want to advocate for all in that regard. Okay, let's get out the door on this one. All right, we just had the Love Day yesterday. That's Valentine's Day, right? That's what they tell me it is. I'm learning. The best love film of all time. Love and Basketball.
Yeah, that's cliche, man.
It's so cliche.
It's cliche, man. What you got?
I would say probably my favorite is Love Jones.
Love Jones. Those two are the top ones that always get there.
I gotta go back with okay, I gotta get the movie right. I'm old school. I'm old soul. I gotta go back to the old school Imitation of Life.
Ooh,
yes,
man, that is.
I like
very good movie.
Yeah, I like the mother's love for her daughter throughout the whole.
That's
ordeal.
good.
That is.
Yeah.
What's
So
the
many
one?
layers.
Okay, I'm gonna go really old school. This tells you how old I am, but I don't know what the name of the film. It was Billy D. Williams and
Diana Ross.
Diana Ross.
Mahogany.
Oh yeah, just dropped the Mahogany.
The story about
Represent Mama. Yeah.
Billie Holiday story. Yeah.
Yeah, that was good too. So yeah, well, happy Valentine's day, everybody. Make sure it's not just on the 14th, but
Every day.
every day.
Yourself
Every day.
too.
Yeah, that's right.
That's right.
Well, hey, we are so privileged to have Dr. LaPrincess Brewer here from Mayo Clinic, also from the Faith Program. We are blessed to have her here today, so let's get into it thick with her. Thank you, Dr. Brewer, for coming. Tell us about your career and what. Oops.
Well, we just want to add. If
I always forget that.
If you got any comments, questions, concerns, you can log into my Facebook on the live feed, and we will ask them live.
Right.
William Bud Whitehorn is the login.
So, Dr. Brewer, tell us about you, the medical field. Why did you get in the medical field? And all that good
Yes.
stuff.
So just first of all, I just want to thank you all for having me on the show.
Mm.
This is an awesome concept, and it's great that we have a barbershop like right next to a church.
Yeah,
How
yeah,
awesome is that?
that is pretty cool.
So yeah, this is wonderful, and I want to say hello to the listening and watching audience as well. But so I would say it's really a privilege to call myself a doctor, and I always say call myself because it's really, humbling that God has chosen me to carry out His work.
Mm-hmm.
And I would say that it all started actually, my initial interest from growing up in the Black church. And seeing so many of church members and people who I actually consider family passing away early from diseases that could have been prevented in the first place. So heart disease, stroke, diabetes. And I wanted to give back in a way so that I could prevent that from happening for future generations. And that kind of sparked my initial interest in kind of this servitude and service to giving back to the African American community. And then I would say, so I attended Howard University in Washington, D.C., HU. And while there, I majored in chemical engineering, actually. And I loved my major. I loved the team-based analytical approach. But there was something missing there. And what it was that human touch. The ability to really touch people's lives and heal, if you will. So I actually took a year, took a summer to do a summer research program. And I worked actually with a cardiologist who was doing both research and medical clinical practice. And it showed me that I could combine two loves, that engineering analytical approach, and then also being able to work with patients and people. So that was the solidifying moment where I said, okay, I want to go to medical school.
Wow. So how was, I often hear about residency, that's like what, 8 years? Is that as intense as it's stereotyped to be?
Man, residency was difficult, challenging, fun. I had so many emotions during residency. So I completed internal medicine residency, and that was 3 years. So depending on what area you go in, it can be longer. Surgical residencies are much longer, but yeah, I did internal medicine residency at Johns Hopkins in Baltimore, and I loved my experience. Would I do it over again? I don't know. But yeah, it was just, it really gave me my foundation, and I loved the patients that I took care of. It was such an honor to be able to be a part of their lives.
So you didn't come from a family of doctors?
I did not.
You're the first to break
I'm the first in my family, meaning from my dad and my mom's, immediate family. Yes.
Oh, wow. So you took a big step.
So it's I don't take it lightly. And again, I'm just truly grateful that God has chosen me to do this.
Absolutely. And how long have you been here locally, doing the faith program and also at the Mayo?
Yes, I can't believe I've been here for 8 winters.
Oh, yeah. I like how you described that 8 winters, not 8 years. I'm going to start saying that. I've been here for 15, 16 winters. Okay, I'm sorry.
Yeah, this is my 8th winter. So I actually moved here in 2012 from Baltimore to complete my cardiology fellowship at Mayo.
Okay.
So yeah, it's been 8 years. I can't believe time just really flies. I remember when I brought my car and everything packed in my car here with my mom 8 years ago. Yeah.
So originally from North Carolina.
Yes.
Very diverse area with our Black folk. Baltimore, the same. You drive up here. How did that go? And again, no just to Rochester, but certainly the demographics are slightly different.
Oh yes, definitely. But I must say, I didn't come here thinking that this was going to be New York City or Baltimore. I had several experiences here prior to coming for fellowship, so I knew that it wasn't going to be that diverse. But my goal coming here was to get training to become the best academic cardiologist that I could
That's
be,
what's up.
so that I could then take those skills to other areas and apply them to this area. And I never would have imagined that I would still be here. After completing that training, but you know, God always surprises us, and we can make all of our plans, but He laughs at them and says, "No,
that's
you're
a
here."
good quote.
So since you're here, how do you like it?
You know, I actually like Rochester. You know, it's very quaint, small, easy to live in.
That's true,
And I frequent the Twin Cities.
There you go.
Yeah, so I go there a lot, you know, for culture, restaurants, concerts. I have a nice network there that I built through my sorority. And also that we reestablished the Minnesota Association of Black Physicians. So I'm also heavily involved with those organizations. And again, it's just, I really like Rochester. You know, it's really easy to get to everything, like 10 minutes away for everything, pretty much.
So that's how you kind of stay culturally relevant, man, going to the cities and getting involved. And you know Angie Porter? She went to Howard as well.
Yes.
You guys there at the same time?
So we were not there at the same time. It's really interesting. So Angie, I consider her, you know, my mentee. But we always joke that she actually had a job before I did because I had so much training to do for medicine. But she got her first major job, you know, before I'm still in training. But I'm very proud of Angie. I know she was a guest on your show as well.
Yeah, she runs the house.
And my niece also, Kalisha Taylor. She's I don't know if you know, she's from Rochester, but she's been going there too. But she I think she graduates next year.
Okay, yeah, and I attended Angie's law school graduation.
Oh, really? Okay, cool. Another Howard.
Yeah, Howard alum rule the world.
Right. So I probably can say this. One of your callings is the issue of health disparities. We often hear about criminal justice disparities, education, economic. Health sometimes only floats, it kind of floats under there a little bit, even in a town like this. How big is the issue of health disparities within the African American community and the growing community here in South Rochester?
Yes, it's huge. And then I guess to maybe define kind of what health disparities are, I mean, it's really, you know, differences in how different populations experience certain diseases. And it's somewhat of a metric or measure for health equity, what we're trying to achieve. And health equity is pretty much giving everyone a full and fair opportunity to have the best health that they can. And unfortunately, there are populations that aren't afforded this opportunity.
Right on.
You know, based on things that are beyond their control. And I'm sure you all have probably heard this term, the social determinants of health. And these are psychosocial factors that, you know, influence one's health. And oftentimes these can be, you know, socioeconomic, political, many that you talked about earlier, you know, environmental factors, and it's really about the conditions that people are born into, that they grow into and live into, and some of these that are, I guess, negative social determinants of health are like food insecurity, you know, housing insecurity, lack of job opportunities, educational opportunities. So I would say that, you know, it's a huge issue, and one of my passions is to not only increase awareness of these health disparities, but also to come up with solutions to these problems, because we can document all we want, but I think the true challenge and the way to overcome these health inequities or disparities is to come up with interventions and solutions for these communities.
I got a question from Facebook. What can we do to empower young women of color to explore the medical field? And also, a second part of that question is, what type of advice would you give them to make them feel like it's possible, because a lot of people feel like it's unrealistic?
Yeah, so thank you for the question. I must say that I am a strong advocate that people are looking at me as a mentor. So the fact that you invited me here, I jumped at the opportunity because someone's gonna watch this and say, I might want to do that. I want to be like her. So I think the more we have people, exposing themselves and showing that you can do this too. I did it. I came from the same background as you did. That it's possible. Then we'll improve the numbers. And I know. You also sent me some information about kind of where we are in the status of Black men in medicine, which is it's a medical emergency, literally. That there are less African American men applying in medical school than there was in the late 70s, and there are now, which is crazy.
Wow.
So I would say to both young women and men out there that you can do this. It just takes focus. It does take time, but you can accomplish it if you put your mind to it. And it takes us it takes a village to get that person through, because I didn't do this on my own.
Right. So. Another question. It might be a DHS question, but what can people of color do to ensure they are receiving quality health care?
So that's a complex question.
My wife, Stephanie.
Shout out to Stephanie. So to ensure that they're receiving quality health care. So we also know that it's not always just, not everyone has access to quality health care. It's not just easy or something that you can just go up to and say, hey, I want a quality, not only medical center, but I want a quality provider.
Right.
But I would say for everyone who does have access to healthcare, be your own advocate. When you go into the doctor's office, the nurse practitioner, whatever your health provider is, tell them what your concerns are, and don't leave until you feel like they've been addressed. And really, when you go to the doctor, have a list of questions, and make sure that your providers explain things in terms that you can understand. And then take that information back to your community as well. And really just, that's kind of, the question is pretty complicated as far as like ensuring that everyone has quality access of care. I think that also speaks to healthcare policy. And making sure that all populations, whether you are unemployed, employed, have insurance, don't have insurance, have access to some care. And that's what I'm also striving for.
And so we can, and one I've noticed in working with clients that Bud and I work with a lot, and we need to get them health care, mental health.
At-risk community, yes.
The stuff that I thought was in place to help clients with low income is not there.
It ain't there.
I'm like, wait a minute, didn't Obamacare kind of solve some of this? So some part of it needs to be a policy up north there in St. Paul, to where, or nationally, to where there's a medical option where folks low income or not can get access to health care. Is that correct?
Yeah, and that's where advocacy groups come in, to help people navigate that very complex process.
Right.
Because some people it can be very overwhelming and daunting, and folks just say, I don't want to deal with that, and then they're sick, and then it just tumbles forward. So we have systems in place that can help. So we talk to case management, social work to help identify resources for you. You don't have to do this alone.
So how do you,
know as well.
how do you, one of the big questions a lot of politicians have about education, a lot of things, but certainly healthcare, is the monetization or the materialistic or the capitalization, that's the word I'm looking for, of healthcare. When you were going through medical school, how did you look at that in the sense of the more money you get to have, the better healthcare you have? Do you see it as a capitalistic thing, or is it a right? Because a lot of folks come, healthcare is a right. It shouldn't be.
Yeah, I mean, I feel that everyone should have access to quality healthcare, no matter what your socioeconomic status is, and that's coming from someone who is a physician. That's what my calling is. I don't need to bias against someone just because they don't have insurance. My goal is to help you feel better. So, that's my take on
Right.
it. And I would say that is one of the reasons why I chose to pursue my master's in public health. Because as you mentioned, and you kind of alluded to, when I was in medical school, I was very disheartened by what I saw, in that some people were being treated differently than others who were of the lower socioeconomic strata.
Right.
And I saw that many of those social determinants of health were being ignored.
Right.
And I'm like, this is why they keep coming into the emergency room for
Right,
things.
right.
They don't have a primary care provider.
Right.
They have this historical trauma that they're dealing
Yes.
with.
Preach that.
They have, mental illness that has not been addressed. So that's one reason why I decided to pursue my master's of public health, so that I could equip myself in developing, again, those interventions to combat those.
Wow, Master of Public Health
Oh, you kind of
Engineer,
answered the question.
doctor. Go ahead.
Yeah, well, it was kind of the question, the last question she asked was the type of health insurance affects, how it affects the type of care they receive. Kind of touched on it right there.
Yeah, and it shouldn't.
Right.
And it shouldn't, right,
Yeah, we should all, as healthcare providers, provide quality access and quality care to all of our patients, because when we don't, that's how we get into those health
Yeah.
disparities.
Right, right.
We're creating them because
Yeah.
we're, giving one group one thing and the other group not so much.
How would you encourage, because I think a lot of us who have overcome or grew up out of the hood, or whatever it is, and now we have health care, right? We got a good job and we have health care, but we're still acting like we're back in the hood. When we're sick, we're not even going to go. I mean, we got a car, we got our coverage.
Yeah.
We still won't go to the doctor because it's just how you encourage folks. Because I think sometimes I'm like that too. Man.
And you got a lot of barriers, like
I'm just gonna rough it,
you don't really want to pay the premiums and things like
Yeah.
that. So I mean, but what would you?
Yeah, so I would say to those in that situation, we're not saying that anyone here does that. I would say don't let your health be an afterthought. So, I am a preventive cardiologist, and in prevention, it's not kind of your fancy, I'm gonna rush you to the cath lab and put in a stent, or I'm gonna rush you off to surgery. I'm helping you to prevent those chronic diseases, so that you
Right.
can avoid going to the emergency room, or suffering from these chronic illnesses that could be prevented in the first place. So I would say no. You should definitely get your annual physicals, and you should know your body, know yourself, know when something
Annual
just doesn't
physical,
seem right to
Annual
get
physical.
attention.
So I get yours, I get mine.
And especially important for African American men,
Yeah,
because
yeah.
That's the truth.
African American men just don't go to the
Guilty.
doctor.
Guilty.
Right.
They just don't get their checkup. So I really
Guilty.
encourage you. It's the beginning of the year. Let's start afresh.
Right.
And go be seen.
All right, I'm gonna go to Al right now because I feel guilty.
As a African American physician, have you experienced pushback from patients when you treat them? Have you experienced that? How do you deal with it if that did occur?
So pushback
In terms of they, what mean that they won't want to be treated by certain minority patients. Have you experienced that?
Oh, so you mean
That's
kind of
patient harassment.
Good question.
almost like a bias of, I
Right.
don't want to be treated by a woman or an African American.
That's a good question.
That is a great question.
Yeah, so fortunately, I have not had any blatant experiences. It could be, that behind my back, maybe someone saw that they were seeing me and maybe requested another physician, and I just never saw that patient.
Right.
But I've never been in the situation where someone like blatantly said, "No, I don't want to see you. Can we have someone else?" And
Have you heard it?
but I was, but yeah, so I have to say, but that it doesn't mean that doesn't happen. And it does, and it has happened and does happen every day at medical centers, including Mayo Clinic. And I'm really grateful that Mayo Clinic actually now has a policy to protect providers in that regard. I mean, you can request up to so much, of what you want to see. Again, we're all here to help as physicians. That's what we've been called to do. Shout out to Dr. Sharon Hayes, for that policy that Mayo has now.
Good. So in all these questions we've asked about disparities, you are leading the faith program. Tell us what that's all
That
about.
was the next
Yeah,
one.
so this should be a whole hour, but I'll give you the cliff notes. So, faith stands for, it's an acronym, it stands for Fostering African American Improvement in Total Health.
Mhm.
And it's a heart health promotion program that's community-based and community-driven. And it was initially started as a part of my public health studies in Baltimore, in which we partnered with a local East Baltimore church to promote nutrition education to prevent chronic diseases. And it took off very well, and just life happens, and fast forward to 2012, it was time for me to move to Rochester, Minnesota, to the cornfields for cardiology fellowship. But the church members there in Baltimore said, you have to take this with you. You touched our church, you can touch other churches. So when I moved here to Rochester, I met with several church pastors who had heard about my work in Baltimore and were interested in developing their health ministries because they were seeing the same patterns as Baltimore within their church. People having diabetes, hypertension, dying from these conditions, and they wanted to make an impact. So the specific approach that I use for my program and research is called community-based participatory research. And it's driven by the fact that the community is involved at all phases of the research process and program, from design, implementation, dissemination. So we had church members from all of the churches that partnered with us to help develop the program. What would be best for the Rochester community is not the same as what's for Baltimore.
Right.
So just fast forwarding a little bit, the program itself that we developed together initially was a face-to-face intervention where we went into the churches and delivered heart health education. And we also had cooking classes, fitness classes. We had a really great time. And the goal was to improve their health behaviors, which we did. And they had made several healthy lifestyle changes. And now the program, based on the community being so innovative, again, I listened to the community, they requested that they wanted the program to be translated to mobile technology form so that they could share it with their church members, their family members, and the community at large. So we now have translated the faith program into a digital app called the Faith app.
Oh, wow.
And that's what you were a part of too. And so it's been, a wonderful journey. We've had several improvements in several cardiovascular risk factors through our program, including they've reduced their blood pressure, they're eating healthier, and after using our app, they double their physical activity.
Oh, really?
So,
That's what. Good.
So we're excited to move forward. Our next step is to do a larger trial with more churches in Rochester and the Twin Cities.
Okay.
Do you need help? Do you need volunteers?
Yes.
I want to get engaged.
Yes. So thank you for this platform to do so. So we are coming up on our recruitment phase for our next trial. So we are hoping to recruit more churches into our study. So if you're interested in having faith as a part of your church, please reach out to us. Our email address is faith4heart@gmail.com. And we can send you more information, but our goal is to have more churches from the Twin Cities and Rochester involved. Pretty much all the Rochester churches that we partnered with before are on board, and there's several more that we hope to get involved. So again, that email address, faith4heart@gmail.com.
You have a Facebook page or website page?
So we don't have a Facebook page or a website yet. It's pretty much we're focused on the app, having the app available, but the app is not, you can't download it per se because it's still in prototype phase.
Oh, so it's not.
Correct, it's still in its research phase.
That is great, and that's a great program, by the way. I was in it for a little bit, and then I went rogue. I'm gonna get back on it, Dr.
We're glad you were in.
This issue of a lack of black doctor, I was surprised at the article when I did my little research on the dearth of black men in the medical practice. Why is that, and why is it so alarming? Because I can see some people, well, why do you need black doctors or black men doctors? Why is it so urgent that men, we need black doctors, black women, but it's certainly black men?
Yeah, so thanks for bringing that issue back up. So there's several reasons why this is an emergency, but I'll start with, again, going back through those figures, because I was alarmed of them myself. So they mentioned in 1978, there were more African-American men in medical school than there was in 2014, which is really mind-boggling.
Yeah.
And I think that there are a number of reasons as to why that happened. Kind of going along to what I mentioned before, people just don't see themselves, the younger generation just don't see themselves as physicians.
Right.
They just don't. I don't know if that's attainable. If that's something that I can do.
Right.
And then also, I would say we may be reaching black men, young boys at it's too late. Like, we start talking about it once they're in college and they've already, kind of decided that's not for me.
Right.
So I think this highlights the importance of pipeline programs and starting younger, starting in elementary school, having people like myself and other black male physicians in the schools and showing them that this is something that you can do. When we're thriving, we're loving this, and we're here to help you to get there. And I would say the reason why it's an emergency and is alarming is that there are several studies showing that African American men are more likely to go to the doctor
See somebody look like
if they see someone that looks
It
like
is so
them.
true.
And also,
like teachers and everything else.
and then you also that there's been studies showing that they do better. So they have better health outcomes.
Wow.
So this is why it's really important, and it goes back to those disparities. So we see the disparities. Black men are dying earlier, have more of these chronic illnesses that aren't being addressed. So we need this workforce diversity, if you will, to help combat that.
Wow, that is something I really learned.
Yeah, and speaking of chronic illnesses that's not being addressed, I want to touch on diabetes, and especially with black men. I was approached by a guy named Leonard Booth, and hopefully we can get him on the show later on. He found out he had diabetes at a later stage because he wasn't getting that regular checkup, and he had to have his leg amputated because of that. So, what can you say? And I know you said it already about getting that yearly checkup, but look, I don't know, and I'm a little guilty of it myself. If my leg ain't falling off, or if I'm still breathing, my wife will tell you I don't want to go to the doctor.
Right. Me too.
The copay and all this is too much other stuff that involved with going to the doctor. And I know I gotta change that attitude. But what can you say?
Yeah, I think you kind of answered your own question.
Well, she's sizing us up today.
She's getting us together, man.
You made some really good points, and thanks for sharing this story. I do wish him well. But I would say that you gotta be proactive.
Yeah.
You gotta go see your providers, and don't wait till it gets that far, because that could have been prevented earlier. So we gotta be seen, and just.
Is there any symptoms specifically with the diet? Because I'm hearing that a lot of times. My uncle went to a diabetic coma without even knowing he had it. While he was driving, he got into a car accident. So is there any symptoms that a person can look for? Yeah, so it can be, scary because oftentimes people don't have any symptoms, and then it kind of gets to that point. But, kind of newly diagnosed, you can have an increase in thirst, more urination. Some patients may experience kind of that sensations of numbness and tingling, in their extremities. So it really varies, the symptoms, but again, you may not have any symptoms. So that's the point of why you need to get seen. I hear that. Don't look for symptoms. Go do what you gotta do.
Yes, exactly. Same with high blood pressure and hypertension. We call it the silent killer. You may not know that your blood pressures are sky high until it's too late.
Oh, that's good news. That's good news. Well, Dr. Brewer, and we'll get you out of here. We all got colds, but we're working through it.
Yes, I'm sorry, I sound like a pinch-nosed person.
You are very, for lack of a better word, vocal. You're out in the community. You're recognized as a great leader. And this is no diss to the other African American and other minority doctors that are at Mayo. We don't see them out in the community as much. And whether they're supposed to or not, I'm not saying, not trying to judge them. But how do we get more of the other minority doctors out, jumping into the community? Or is it just that you see it as your mission and your passion?
So I can't speak for everyone, but you know, it definitely is my passion, and it aligns well with, you know, my clinical interests, my research interests, and then just my own passion to improve the health of everyone, not just the African American community. But I would say having forums like this for us to come to speak to the community is great, and I think some of my colleagues would love the opportunity to come and go to be on your show to spread their mission. They may not know of avenues to do so.
Well, I know we would love to have them.
Yeah, because that would be, I mean, and as you already know, because you're an example, you spoke of it, coming from where you come from, but that would be huge to our young men and women to see these black men and women, these minority doctors. Oh my goodness! And that was huge for me coming out of the hood I came out of, was the exposure piece. Okay, wait a minute, college, what is that? And then things grew from there. So
this is a call to my colleagues.
We'll get them out.
Come on out.
Well, this is a question we ask all of our guests as we part, and that is, and there's no question with you, Dr. Brewer.
We know.
There's young ladies out there, young men, and even older folks that are like, wow, I don't know if I can ever be a Dr. Brewer. What can you say to them to encourage them to step out and do their thing?
So this is definitely my passion. So, you know, I would say you can do it, because I was that young little girl who, you know, grew up in the projects, didn't have, you know, a lot growing up with my single mother. And I would say that you can do this. Have your mind set on a goal, and make sure that you place people around you that are going to support you. Because again, it took a village for me to get where I am now. And I'm so grateful to my mentors, my mom, my family members, and even my friends that have been supportive of me on this journey. So I would say hang in there, do well in school, and take advantage of resources around you. I would say that, you know, when I was in elementary and middle school, I participated in summer research programs and pipeline programs that exposed me to college and what that was. I'm applying for college. I'm taking the SAT. What is that? How do I prepare for that? What is that? So get to know your guidance counselor. That definitely helped me along the way of knowing what opportunities are at my avail. And another thing I would say, this is from a personal standpoint, be strong in your faith. So for me, that's what really has gotten me through this entire process. You know, whatever your faith is, you know, that really gives you a strong foundation to get through those challenges. So that's what I would say.
That is encouraging.
Yes, don't let your circumstances dictate the level of success.
Exactly.
All right, well, there you have it, Barbershop Talk. Thank you for tuning in. Enjoy the heat wave today. 31 degrees.
It's almost springtime weather today.
See you later. Thank you for tuning in. Thank you, Al, for coming.
Thanks, Al.